Hey everyone, welcome to Step 2 CK Pearls by Books, Medicine and Scrubs. Today, we're going to learn about acute gouty arthritis flare. A 70-year-old man comes to you with the following history. He has a 4-hour history of pain in big toe of the right foot. He has fever, his blood pressure is a bit high, his pulse is a bit high. However, the serum creatinine is definitely high because the normal serum creatinine is up to 1.2 milligrams per deciliter. He has a past history of peptic ulcer disease and renal impairment. Now, when you examine joints in case of arthritis, it's very important to ask the following 4 questions. You have to make sure that are involved in order to rule out whether it's monoarthritis, oligoarthritis, or polyarthritis. You have to establish whether the arthritis is symmetric or asymmetric. You have to know whether the condition is acute or chronic. In our patient, it's an acute situation. You have to establish whether there are any other symptoms which are extra-articular apart from the joints. Like in our patient, there is fever, there is a high blood pressure, his creatinine is high, so these would be extra-articular symptoms. On physical examination, the big toe of the patient looks red, hot, and swollen. This is also known as podagra. You plug in a needle here and draw out some synovial fluid, and you examine it, and you see negatively birefringent crystals, which are needle-shaped under polarized light. So now you know that it's confirmed the patient is suffering from gout, and it's an acute attack of gout. So how do you treat this patient? The treatment is based on the patient's age and his comorbidities. What options do we have? Our options are NSAIDs like indomethacin, which is the first-line treatment. Option 2, second-line treatment, is colchicine, which inhibits microtubule polymerization in neutrophils. Then there are systemic corticosteroids or intra-articular corticosteroids, which are considered if only 1 or 2 joints are involved. What will be used in this patient? The answer is intra-articular corticosteroids. Why do we use not the first line, not the second line, but the third line drug here? And also you have to make sure that there is no infection in the patient before you use corticosteroids. Now why? This is a beautiful table depicting the management of an acute gout attack. You put ice and rest, and then comes medical treatment. In that, you first see if the patient has any contraindications to NSAIDs. What are the contraindications? Peptic ulcer disease and kidney disease. And our patient has both. So when it's there, if you have no contraindications, you can administer an NSAID like indomethacin for 2 to 3 days. But if there is a contraindication, you go to colchicine, the next best option. However, if there are any contraindications to colchicine, you have to go on to steroids. What are these contraindications? They are kidney problems. Toxic levels of colchicine are also harmful. We'll just find out how. So then you move on to how many joints are involved. If only 1 or 2 joints are involved, then you think about the contraindications to joint injection. If there are contraindications, you move here. You give them oral corticosteroids or systemic corticosteroids until the symptoms begin to resolve. This is also done when there are more than 2 joints involved. And if there are no contraindications to joint injection, you give intra-articular corticosteroid injections. So our patient has just 1 joint involved, and if he doesn't have any contraindications to joint injection, we will probably go with this. Otherwise, we'll go with oral corticosteroids, and in even severe cases, we go with injectable corticosteroids. That's parenteral corticosteroids. Now, what are the contraindications to the use of NSAIDs and colchicine in acute gouty flare? NSAIDs, as we just learned, peptic ulcer disease and renal impairment. Colchicine, renal impairment. Toxic colchicine doses can cause bone marrow suppression. Ooh, that sounds nasty. And neuromyopathy, which sounds even more nasty. So definitely avoid this drug if the patient has kidney problems. I'm sorry about my drawing. So as a summary, I would just like to say that the Step 2 CK, it wants to know if you can keep the patient alive in case of emergencies, and this is definitely an emergency. And here you know that you are not supposed to give things which would make the patient worse. And that's why we would go with corticosteroids. Keep learning and have a great day.